Well, hello. I apologize for how I sound. I'm sick. My name is Hannah Moore, and I will be showing you a few facts and things about Angelman Syndrome. Now, I want to tell you, before I end, I have a YouTube link, a video of what Angelman Syndrome, Angelman's disease, looks like. And it's a cute little video. It's only a couple minutes long. I encourage you to watch it. Right, what is Angelman Syndrome? Angelman Syndrome is a neurogenetic disorder that occurs in 1 in 15,000 live births. AS is often misdiagnosed as cerebral palsy or autism. And that's just because it takes a while to be able to detect what's going on. Characteristics. Developmental delay. Now, I'll put this into perspective. I deal with Angelman Syndrome on a day-to-day basis. And the gentleman that I deal with, that I take care of, round-the-clock care, is a 31-year-old man with the mentality of an 18-month-old. So it's very difficult, for certain things. If he were to be getting into something, or I'll use myself as an example, if I were to be getting into something that I'm not supposed to, and I had Angelman Syndrome, at my job, my place, we would use a phrase like, not for Hannah, not for Hannah. We have to wait. We have to wait. Calm body, because he hits his head a lot and stuff like that, and he hits us, and he'll cry sometimes or laugh. I'll get to that. Because he is nonverbal, and that brings us to lack of speech. Most of the people with Angelman Syndrome have no... they can't talk. They can't communicate in an effective way. Now imagine a baby, basically what do babies do when they need something? They cry and they scream and they do all sorts of stuff like that. Well, imagine a toddler that can't talk very well yet. They cry, they scream, they throw a temper tantrum to get what they want, and you got to figure out what they want. That's kind of what my gentleman does. And he has seizures. Only I've ever had a handful of seizures in his life. But most of the time, seizures kind of come with a package deal. Not all the time, but sometimes. Walking and balance disorders. Now, imagine somebody that walks with, their feet shoulder width apart and their knees kind of bent inward, and they need help walking. Sometimes with, swimming, you take them swimming and you let them walk in the pool. The buoyancy really helps. That's something that we do at Mosaic for the gentleman that I take care of. Alright, just some background information on Angelman Syndrome. In 1965, Dr. Harry Angelman was the one who discovered it, because he was working in a mental institution, and 3 children had all been admitted. Different children, weren't related by any means. And, I have on here, he noted that they all had stiff, a jerky gait, absent speech, excessive laughter, and seizures. And these are typically, the characteristics right here and on the previous slide are usually what kind of determine Angelman Syndrome. And of course, the missing chromosome. Most cases, they're not hereditary, but this is something that anyone can be born with. And it's just a deletion of the maternal chromosome 15 or paternal uniparental dysmy. And it occurs as random events during the formation of reproductive cells or in early embryonic development. So basically, when the embryo is forming or the sperm and the egg meet, if the exchange of chromosomes doesn't go, I'll use, go like this, perfect fit, and it kind of goes like this or like this, and you got something missing in here. So that's kind of how I look at it. It doesn't fit well together. It kind of fits like this. And you're just missing that one piece. Something majorly drastic can happen for the rest of your life, such as Angelman Syndrome. It's usually detective when, you're about 6 months old. Sometimes it takes up to a year. It just kind of depends on how well baby develops. Because my gentleman, how it develops for him is he developed normally, but then he regressed to an extreme kind of type thing, if that makes sense. Seizures don't happen until about 2 to 3 years old, usually live a normal lifespan, but they need 24/7, 365 days a year, round-the-clock care. They will not be able to take care of themselves. They will always have to have care. And, you know, some of them can do things like this. This is my son's homework I'm using as an example. Some of them could trace letters, you know, or make pictures or color or something. But then others, you know, you give them a crayon and they'll just eat it. That type of a thing. It just kind of depends on the severity. And it's not common. This is not a common, you know, disease. And it's very, very interesting to read about and learn about. And I decided that, you know, I kind of wanted to do something different rather than, you know, just go for the typical psychological disorders. So, hope you enjoyed it. That's my Works Cited page. I encourage you to check out the YouTube video that I've also attached to this. Thank you. Have a good night.